rocket. Now, if it's going up that high, naturally, there's more hospitalization. 2 to 2.5 times more hospitalization. Why? It's breaking into more houses, mashing up more lung cells. Therefore, your oxygen requirement and your ability to get sick is 2 to 2.5 times higher. And who did they notice it in? It's now being shown that those who are managed to fight it without the vaccine, not anymore. It's gotten a little bit too good at breaking in. So those who are less than 50 and not vaccinated are the huge part of the population that's causing the spike. Because naturally, a part of the rest of the majority of those who have been vaccinated have been prioritizing people over 50. The concerning part is that the people over 50 who are vaccinated but have a lot of comorbidities, diabetic, hypertensive, obese, meaning they have other illnesses, are almost just as susceptible. That is where my heart sank. Here's a quick slide. It's a bit busy, but I just use this as the backup data. This was a leaked report from the CDC. What is it showing? It is more transmissible than Ebola, MERS, the common flu, and smallpox. It is as easy to spread now as chickenpox. And the data coming out of Scotland, Singapore, and Canada, it is supporting the fact that death rates are going up because of it. So if you get infected and are not vaccinated, what happens to you? Remember I said each virus, each intruder has a house it likes to break in. I said the virus, this one, corona, likes to break into the lung cell. What about HIV? HIV likes to break into the general. The CD4 T helper cell, kill the general. If you kill enough generals, you've decapitated the immune system. And that is the whole army. You take out the leader. That is how them get acquired immunodeficiency syndrome, AIDS. That is why they measure your CD4 count when you have HIV to see if you get AIDS yet, because it's how many generals has it killed. But corona likes to break into the lung cell. What happens to you? Well, you could fight it, you'll be asymptomatic, you might have flu-like symptoms, cough, respiratory issues, or you might go down the path of oxygen dropping. That's why they measure the oxygen. It kills enough lung cells, pneumocytes, that you can't even oxygenate your body and you could die. But it's not just the lung. Especially the Delta variant, they've now started realizing it affects more than the lung cells. It is specifically adept at affecting your cardiomyocytes, so your heart. All the variants are starting to affect the brain, the heart, the lung, the kidneys. So it's affecting many organs. And you start talking about the long-term effects. Back a few months ago, it came out in Nature about the long haulers. I think it was March 22nd, where they talk about 6 months, a year later. Yeah, you may have been asymptomatic, but you start to have symptoms, and even people are dying 6 months, a year later, who were fine early on. I liken this to the Chick V phenomenon. Many people in Jamaica remember Chick V. I might know somebody who had Chick V, got over Chick V, didn't die of Chick V, and all years later, them still pain up. Still have joint pain. That's what I call long-term symptoms. You are rolling the dice, not at only creating a new monster that could affect everybody, but at your not short-term, but your long-term consequences as well. So I spoke about all of those. What happens to society? Now, when I started talking about this to different groups from all over, Jamaica was in the New York Times. This was back in February, and it had the second worst outbreak in the world at the time. When I looked at the numbers at that time, there was a peak at a 7-day average of about 635. The total numbers at that time, 500 people had died. This is in March, mid-March, 32,000 cases. We've gone 4 months later. At that time, with just 32,000 cases in the country, hospitals were overwhelmed. Look at the date, February 23rd. They were turning away patients. I was operating in Kingston in mid-March, and the anesthetist was on the phone with KPH, Kingston Public Hospital, in a panic because they had 12 hours left of oxygen. You imagine you show up to the hospital at that time and you needed oxygen. You goes cook. right? So where are we now? 4.5 months later, look, you can see the peak coming up again, spiking again. We have almost tripled the amount of people dead in that time. And that is less than double the incidence of recorded. We've gone from 32,000 to 59,000, and we're at 1,339 deaths. In fact, this is an article from this morning where the CMO spoke about the last week, okay? He spoke about in the last 7 days between the 11th and 17th, inclusive of those days, 85 people have died in Jamaica. 15 were between 60 and 69, 19 were between 51 and 59, 20 were between 40 and 49, and 5 were in their 30s. So this is not remote to Singapore, Scotland, and the rest of the world. This is happening right here at home. That's the data. This is data from last night. 19 people died yesterday in Jamaica, 19. I remember when my heart used to sink, when the murder rate was 3.5, 4 people a day. This is a gunman going across the country, killing on average, see their 7-day average, 12 people a day. And it is showing no mercy based on age. If we talk about kids, there's something called multi-inflammatory syndrome in children. At least 37 have died across the United States from corona, from this particular thing. Kids are not only where my heart's, because I'm a father. I worry that, yes, they may get sick. Yes, they may have long-term consequences. But if we don't protect them and mask them and protect these children, they're also the vessels in which you could create the new monster. So if you get infected and not vaccinated, what happens to society? With further spread of the virus, if you can't look after the infected because we're overwhelmed, the CMO said there have been 100 admissions across Jamaica per day for the last 3 days. We're already stretched when the numbers were half of what it is now. Best believe you're going to get more death as we've overwhelmed the system and can't look after those who are now showing up. And not only can't look after the COVID patients, you can't look after the ones who do have COVID, the diabetic, the person who needs surgery. All the resources are going towards looking after COVID, so there's a knock-on effect. So what do we know about the side effects of the vaccine? Anybody who's gotten the shot, you might say you might have a little soreness, sometimes none. I can tell you that, especially after the second dose, or maybe if you had COVID in the past and now you got the shot again, you might go home and you might, for 12 to 15 hours, have chills and little aches and pains. That's not because you got the virus, because you did not get the virus. You got the hat. Those little chills and aches and pains, that's your immune system scouring the body, because when I got the shot, I got my second shot 3 weeks later, I have the army. Army's there. The hat, they give me the hat again and say, hold on, he's here. They start going from head to toe looking for him, and after 12, 15 hours, they don't find him. Symptoms gone. Why does your temperature go up a little bit? Because this SWAT team works better when your temperature is a little higher. It's because of a cytokine, little signal that goes to the brain, raise the temperature. It's called IL-1 and IL-6. That's why I have a fever. Not because you got the virus, it's because you got the hat. Okay. Back in March again, when I was presenting this, when you're talking about no side effects or little to no side effects of the vaccine, at that time, 200 million people have been vaccinated. 112 million people had the virus at that time in the world. And of that, 2.6 million had died of the virus, but you couldn't find not even a handful of anybody. You couldn't even count anybody who died from the vaccine. That has more than doubled now in terms of the amount of people who have gotten shots, the vaccine, and the death rate from the virus. Some people say, I don't want to be a guinea pig. Billions at this point. Hundreds of millions have gotten the vaccine. How many have to get it before you realize that you're not the guinea pig anymore? So what about this clotting thing? I'm going to wrap up shortly. But let's talk about the clots, because that was a topical issue 2-3 months ago. When they say, well, AstraZeneca causes clots, and they were hesitant to say whether it was AstraZeneca or not, or even Johnson's or not. And it took about another week before them say, well, there might be an association. but it's 1 in 250,000 might get a clot from the vaccine. Why were they so hesitant? Because the virus causes clots. If you caught COVID, you had a 1 in 12 chance of getting a clot in the leg, 1 in 9 chance of getting a clot in the leg, 1 in 12 of getting a clot in the lung. And if you ended up in the ICU, you had a 23%, 1 in 4 chance of getting a clot. Not 1 in 250,000. That means if everybody in the country of Jamaica got the vaccine, maybe 8 to 12 might get a clot. Not 1 in 12, not 1 in 10. And we know how to treat it. So let me put that in further context. If you take the oral contraceptive pill, you have a 1 in 1,000 chance of getting a clot. If you take a flight longer than 3 hours, 3 to 4 in 1,000 of getting a clot. If you smoke, even higher. So let me wrap up at this point by saying, remember, if you're going to make a decision to get the vaccine or not, I'm not calling it an alternative to living healthy. Yes, live healthy, eat well, eat your vegetables, be healthy. But the things we vaccinate you against are the things that will take down the healthiest person. So I don't call this an alternative, I call it a complementary medicine. It's not in place of living healthy. I want you to have the squadron at the door if the gunman ever show up. So that he can't multiply, so you don't have enough to give away. And he can't change. Because he started to change. The heart is changing. It is a race against time. So I'll close there. And I'll open the floor for questions.
Wow. Wow. Dr. Arscott, I can truly say I've never heard anything explained like that. I'm sure Mr. Zaka, who's still with us, can say the same thing. Thank you, Ramon. I know that this comment will please you greatly. K. Dean on Instagram said, well done, Dr. Arscott, delivered like a true Taylorite. Is that true? Wait, hold on. Wait, no, you're muted. So say that again.
At the people, all right, there are only 2 halls on campus.
Oh, God.
Assembly Hall and Taylor Hall.
Oh,
I'll leave it there.
Wow, you went there. Whoa.
So
that means,
big up all the new people.
All right, so thank you very much, Dr. Arscott. You have answered many questions already. Is it that you're not hearing me, sir? Tell me if you're hearing me. Thumbs up if you can hear me.
I can hear you now.
All right, fantastic. Okay, so there is, you captured so much in that presentation a while ago. And as I said, we did say before that we have opened this event or team event. This was only for the Sagicor team. Then we opened it up to many other companies because, as Dr. Arscott made us aware, there were companies who were seeking your information as well. You didn't just go to UE, you went to Harvard, you went to Oxford. We claim you for UE, but you know. And now there are many persons who really want to hear from you and your explanation, which I can tell you honestly was really something to behold. And there are some questions that we have from our team members, which I'm going to ask first. We asked our team members to send in their questions ahead of time. So team members who are joining via Zoom, I do have some of your questions here. And I'm going to try to get through as many as I can. I know you said that you'll stay on for as long as possible, but it's many, many questions. Can we trust a vaccine that was developed so quickly?
Okay, great. Great question. Thanks. I understand the connection. Am I echoing? Can you hear me?
I'm gonna turn you up a little bit. Go ahead.
I can't hear you. Hear me?
I'm hearing you.
So, I'm echoing still. As I said in the.
All right, hold on, Dr. Arscott. Let me just fix that. So I'm going to ask you 2 questions. If you can hear me very well, you can probably write it down so that you can answer them two at a time, perhaps. Maybe that will make for greater efficiency. Can we trust a vaccine that was developed so quickly? And is the vaccine only to be considered for emergency use authorization, EUA? Now, you made mention earlier of a lot of hats, and I particularly loved the general argument. That was hot. Tell us though, can we trust a vaccine that was developed so quickly?
Sorry, can you hear me?
I can.
Okay, perfect. All right. As I mentioned, this was not created overnight. It took 30 years. I'll just run it by point quickly, just in a bullet point. They started working on how to give you the hat, how to give you the manual, the mRNA, to get that hat inside you in the early 90s. When Corona started showing up in 2003 as SARS, because remember, you call it COVID, but the virus is called SARS-CoV-2, meaning because it's a second, it's been here before. They started working on the vaccine then. It showed up again in 2012, MERS, same coronavirus family. They were working on it then. When it showed up in 2019, we're talking about almost 30 years of work that went into this. This did not come overnight. They literally, when it came up, they sequenced it. They said, okay, oh, he has a green hat, blue jacket, brown shoes. And they called him and said, look, make the mRNA, make the book for the hat. That was done literally within a weekend because they had the technology to do it for 30 years. That was worked on for 30 years. So that's one. Let's talk about this emergency use versus FDA approval. Let me say up front, it is being FDA approved. It is a matter of logistics and paperwork. What is required to get FDA approval? 6 months of follow-up data from release of the vaccine, okay? When they've worked on it, 6 months of data. When did Pfizer and Moderna start their trial and get it out? Remember I said August to about October. August to about October of 2019, they're working on this. And the 96% efficacy, the rate of preventing death, preventing hospitalization, saving people was so compelling. And the death rate was going up so high, they turned to the FDA and said, look, we have this thing. I know it's only been 3 months, but hey, look at the data. We'll get you the other 3 months as soon as the 6 months done, but your people are dying. Look at it. It is safe. It is not the virus. It's just the hat. And they said, okay, get the rest of the data for the 3 months and we'll give this emergency use authorization because people are dying. So they released it late 2019 after seeing the data from August to October. So by January 11th, I got my first job. What do you think happened by May? In May 2020, Pfizer and Moderna submitted the 6 months of data to the FDA and said, see that? Everything, nothing's changed. It is as safe as it was when I showed it the first time. Historically, it takes about 6 months from the final submission for the FDA to say, all right, fly the gate, everybody, this is approved. Fauci said last week that it's about, so 6 months, by the way, from May would put you towards the end of the year, which is why they said it's probably FDA approval by early 2022. This is not regular times. They're tranching through the data and trying to get through the bureaucracy to say FDA approval. It's not whether it's going to happen, it is happening.
Okay.
It's literally just paperwork.
I do have another, I mean,
worried about, oh, is it safe? Is it not safe? Why is it emergency use? It's because of those criteria and the data is there. The data has been submitted. It's safe.
Okay. Thank you for that. So I have another question. If you can take this one. And this is from one of our team members. I heard the symptoms of the virus can be similar to those of a sinus infection. If I'm experiencing said symptoms and I just treat them with over-the-counter medication, and God forbid it really was COVID and not just a sinus infection, if I'm vaccinated, can it just quickly or unexpectedly escalate to land me in the hospital or even kill me? That was a very serious worst case scenario that we have we typed out and, we thought about, but it's something that even I have thought about before I got vaccinated. if I had COVID and I didn't know, could I have killed myself by using the over-the-counter medication that I normally take if I have a cold or a sinus infection?
All right, so great question. There are several parts to that question, okay, if I'm understanding correctly. If you had corona and you thought you had a sinus infection and you're just treating the symptoms of what you think is a sinus infection, the sinus medication won't kill you. Okay, if that's the first question. If you're just treating the symptoms, in general, what we're doing, we are supporting a patient through a viral infection. If they didn't have the army, they didn't create that army because they didn't get the vaccine, all we can do is support them through the infection. If they got bad enough, they need oxygen, you give them oxygen. If they have a fever, you give them Panadol or paracetamol, etc., etc. Those, if your question was if you got the vaccine at the time of the sinus infection or after, is that a question?
Yes.
Okay.
Let me read it again. That part. Let me read that part again. If I am vaccinated, if I am experiencing said symptoms and just treat them with over-the-counter medication, and it really was COVID and not a sinus infection, if I am vaccinated, can it quickly or unexpectedly escalate? So, I suppose, go ahead.
Great question. So there is something called a cytokine storm. It's very rare, very rare. And it was being seen in the early days of COVID, where somebody said, well, I'm in the midst of a COVID infection and they gave me the vaccine. And they said, hold on, the gunman is here. No, his hat is showing up over there and the immune system goes absolutely berserk and it starts to shoot up the whole place. That's what we call a cytokine storm. And the signals that set off the immune system, because it feels like it's now being attacked from every corner, specifically was certain cytokines, what we call IL-1, IL-6, TNF-alpha. Either way, they figured out why these signals were going off and they created a medication, an antibody against those signals. And what suppresses that cytokine storm? Steroids. Which is why when you go to the hospital and they're really sick, they're not just giving you remdesivir, they're giving you steroids. Okay? So in the early days, they were like, what is going on? Then they realized what's going on. They said, okay, this is how we prevent it, this is how we treat it. Then they said, okay, so is it safe to give when they're sick? Should we wait? So initially they said, wait 2 months after you got COVID before you give it again. Then they realized, then they said, you don't need to wait 2 months. And Vivek Murthy, the Surgeon General, he was at the Brigham with me as well. He said, 2 weeks after symptoms are gone, you can go get the shot. So they moved, you've watched, because everybody's so attentive to this particular pandemic, you've watched the evolution of how the frontline workers are dealing with the enemy on the battlefield. When they saw what was going on, so I understand where the question came from, I understand the concern. I'm just saying, this is how it evolved. This is how we've found out how it's happening, how we treat it when it rarely does happen. And if you did end up with any symptoms, wait 2 weeks after all symptoms are gone, then you get the shot.
Okay. All right. Another question for you. The production of the vaccine appears very fast. You mentioned, you did speak about this before, that, and now I am educated as well. We started in the 1990s. We didn't start last year. So that's something that we also have to be mindful of. But do you know any of the tests, or are you aware of who it was tested on? A lot of persons have raised that question. Was it tested on human beings? Was it tested on animals? Are we safe? Who was it tested on?
Great. It's a great question. So for you to get to a trial, okay, for you to get it to humans, for the FDA to say even just emergency use, it has to go through at least 3 phases. Okay, you're right. The first phase is actually phase 0 is in an animal. Okay, you say, will this thing kill a living being, as in the vaccine? And they say, no. Looked at the safety profile. Then they go to phase 1 and they gave it to a couple people to say, is it safe? Literally a handful of people. Then they get to scores of people in phase 2 and say, okay, we're now going to give it to many people and say, is it effective? Then they get to tens of thousands of people. It was about 163,000 in either Moderna or Pfizer, and then 46,000 in AstraZeneca. It's around those numbers. I don't have the data directly in front of me, but we're talking tens of thousands that divided into two groups, those who got the vaccine and those who didn't get the vaccine. So human beings. The difference with the trials, Johnson & Johnson was done in Brazil, South Africa, and the United States. AstraZeneca was done in the UK and Brazil. Pfizer and Moderna was done mostly in the West, in the United States. Right? So yes, it was done on people. And what are they looking at phase 3? We're giving it to tens of thousands of people to see when you give it to a lot of people, are there any rare side effects that we didn't see when we just gave it to 100 people, 200 people? So first, is it safe? Then is it effective? And then is it any rare side effects? When they did that and they saw the data and they was like, wow, look how much protection the people who got the vaccine have to those who don't have the vaccine. They said, turn to the FDA and say, look, we're 3 months in, 3 months of follow-up data from the person who got it first time. We need to release this because people are dying. And now they have the whole 6 months, the entire data is submitted. It's still consistent, which is why it's literally, what happens when it gets FDA approval? It means governments, schools, industry can mandate that you have to get it. They can stop you from coming into the country without it, once the FDA approves it. They've already started doing that. They're ahead of the final because they know the approval is coming. There are certain places I can't travel to without certain vaccines. This is not new. I can't go to South America with certain vaccines. I can't go to certain African countries without certain vaccines. This is not a new edict.
Dr. Arscott, can I ask you your thoughts on, I mean, you made mention a while ago of the fact that it's not an if, but it's a when. And you touched on a very critical point. I mean, we've been talking about it on social media forever, that soon America is going to say you can't come here without a vaccine. And soon there's going to be all kinds of foreign countries are going to say you have to come. And we're speaking in our Jamaican context here, yeah? Do you think it's going to be what type of vaccine is approved by the FDA, or do you think that all of them will be approved? Is that what you mean when you say not if, but when?
Okay. Currently, it's all the ones that we have in the West, I should say.
Okay.
When I speak about vaccines, you have to realize that there's some others out of Russia, China, Cuba.
Sure.
I'm speaking specifically about, when I talk about giving you the book that tells you how to make the hat, I showed you the 4 that we have. There are vaccines out there that came out of China, right? Like one called Sinopharm, that's in Trinidad. And what did they do with that one? They used old technology. Remember, how did they vaccinate you against measles and mumps and rubella? They take the gunman, take away the gun, and give it a live gunman and say, well, he's weak now. He's weak enough for 2 weeks that you create an army, and now you can, if the gunman show up with a gun. That is what the Chinese did. That's what Sinopharm is. They gave you the live coronavirus without the gun. They have a live attenuated vaccine. That's not what's in Jamaica. Okay. That's not what's in the United States. That's not what's in the UK. That's not what FDA emergency use authorization. It's not even the EMA didn't even allow that, which is the European FDA. Okay?
All right,
look at the data, Sinopharm doesn't protect you not nearly as much as the army you have when you have the vaccines we have. So it's the ones we have, don't wait. You know what, I'm going to wait on Johnson & Johnson. Or, you know what, I'm going to wait on whichever one comes. Honestly, because you don't want to be the one who not only might get sick and die, or have long-term symptoms, or if you even survived, you are the one that created the Kingston variant, the Mandeville variant, the St. Elizabeth variant.
Ooh.
Right? That has become either picked up a bigger gun or is more transmissible.
Yeah, viruses are doing what they do. I heard that. Viruses are mutating, and that's what they do. We do not. When you said Kingston variant a while ago, God forbid, I mean, my back. I felt that one. Let's get topical for a moment. Yesterday it was announced that the Delta variant is within our shores. 22 cases have been, I guess, identified is the term. It's very contagious. How easier, if this is another question from one of our team members, how easier is it transmitted versus the original virus? And I want to frame this a little bit more. So COVID fatigue is real, but the Delta variant it's almost like it's brand new, almost like we're going all the way back to last year, March, when we were on our P's and Q's, for want of a better phrase. How serious is this? How contagious? How deadly?
All right. So thanks for that question. It allows me to summarize that slide that I showed you about the Delta variant. Okay. One, the mutations in the hat, i.e. the spike protein. Remember, it's a key. It made that skeleton key that breaks into the lung cell a lot better at picking the lock. So it gets into more lung cells, which is why it makes more virus, because it hijacks more workmen. It hijacks the workmen within your cell to make more virus. So when they swab somebody who got infected with the Delta variant and they measure how much virus you have in the back of your throat, it was 1,000 times higher than the Alpha variant that we had when we had the initial peak. 1,000 times. If you have more virus multiplying and in the back you have more to give away, which is why they say it's more transmissible. How do they measure how transmissible it is? Well, there are two measures. They say 64% more transmissible. That don't mean anything to half of people. They don't understand what that means. So we use what we call the R value, which is what? If I have it, how many people can I give it to on average because of how much virus I have? The Alpha variant, the ones that we had when at the first peak, if each person who caught COVID had the ability to give it to 2 or 3 other people. The Delta variant has the ability, when you have so much, has the ability, what they call an R value of 5 to 9, meaning up to 9 people you could have enough virus to give to as an infected person. You've tripled it, which is why the cases are skyrocketing. So if you have more to give away, it's better picking the lock and getting in the lung cell. Therefore, it gets into more lung cells. It makes people more sick, which is why the hospitalization rates have gone up by 2 times and why the death rate is now on average 12 a day. Yesterday was 19 died in Jamaica. The hospitalization, 100 people were hospitalized every day for the last 3 days in Jamaica. You tell me. I know my colleagues, you talk about your fatigue, the people on the front line, their back is breaking. My heart is breaking when I sit and I hear what's going on and being on the front line. So those are some numbers to give you a sense of how bad this thing is.
Okay. And what are your views on the safety? The Pfizer vaccine touched down today in Jamaica, and we're going to be prioritizing students, children who are 12 to 18. What are your views on that? Is it too soon to vaccinate our young ones?
So great question. I will tell you, I have the Pfizer vaccine. When I was vaccinated, I got my first shot on January 11th and my second shot on February 2nd. And it was Pfizer. That's all I had. My son is 4. And if we're all on tenterhooks waiting on them to fly the gate for the younger ones. When you say, is it too soon? Remember we spoke about phase 1, phase 2, phase 3 trials. Those trials have not only happened, they went on in parallel. For instance, at AstraZeneca, they did the 12 to 15, the 5 to 11, and the 2 to 5-year-olds. What are they looking for? What's the dose to give them? What's the dose to give them? Is it safe? Not only did they find that it was safe, they found that in the phase 3 trials that the children created twice as many antibodies. You remember the squaddy that created the handcuffs? Twice as big as an adult. So they were more protected. Okay? When you talk about So that's why they say fly the gate on 12, and they're just working on the dosage for the 5 to 11-year-olds. It has been universally safe. There's been no deaths from the getting the shot within those trials. And since we're talking about children, let me just make a quick line about pregnancy and whether you're pregnant and is it safe to get the vaccine if you want to get pregnant or if you're pregnant. Absolutely. Absolutely. What did the studies show? Pregnant women who are not vaccinated, 1.4 times higher chance of being admitted to hospital if they catch COVID. If you catch COVID and you are vaccinated, when they measure the amount of handcuffs in the mother, the baby is born, they found the handcuffs from the vaccine, the antibodies in the baby. So the antibodies, the squadron you created when you got the vaccine as the mother was passed on to the child. So that child who couldn't even get the vaccine is protected. So it was not only safe for the mother, but it protected the child. Infertility, absolute. It's just an unfortunate debunked theory about this whole infertility thing, and why I'm not going to get it because I can't have baby and shedding and so on. It was a letter written to the EMA a few months ago by two scientists in Europe who claimed that the spike protein had a similar makeup to a protein on the placenta called syncytin-1. First of all, not true. They looked at it, there's no syncytin-1 on the spike protein, nothing. Because they're saying if you create antibodies and handcuffs to the spike protein, then you're going to create antibodies and handcuffs to the placenta, and that's why it's going to affect fertility. Not true. They debunked it. They show that there's no molecular similarity. It doesn't even exist. But once it gets out there, the conspiracy theory just takes off. And so I just want to dispel that and leave that there.
All right. That was excellent. That was an excellent way to dispel that rumor. I think we should just clip that part because that's a major rumor that's out there, I have to say. And then there's another question, another team member at Sagicor. Those of you who are joining us on Instagram, YouTube, well, not YouTube, we're going to upload the YouTube video later on, but those of you who are joining us on Instagram and Facebook, we are going to get to your questions, we promise. But another question, can you explain or whether or not the vaccine can cause DNA to change? This is a huge rumor in Jamaica.
Great. All right. So let's touch base on DNA and RNA and all that again. All right. Remember, I told you about what happens inside your cell. Your cells are just houses. 37 trillion houses. Your whole body is a neighborhood. And viruses like to break into a house. They're the intruder, because they have to get into a house in order to hijack the workmen in the house, what we call ribosomes, and say, yo, make more of me. And then multiply inside the house, ransack the house, mash up the house, and move to the next house. Okay? And how do they do it? The virus gives the workman its own RNA, its own DNA, its own book on how to make the virus. And go and say, make more virus. Okay? When you look inside a cell, there are two books. One book is RNA. The other book is in a safe in the bedroom. That safe is called a nucleus. That book in the safe is called DNA. Okay? The workman cannot read DNA. It's written in Latin, in Spanish. It has to be transcribed into RNA for them to read it. RNA cannot integrate with DNA. And when you give somebody, if they say, I give you a book of DNA, it can't get inside to integrate with it. The books can't mesh. It's like I say, I give you a piece of paper and it's going to find a way to fit into a book. It doesn't happen. The 30 years of research was one, if we gave you an RNA book, what happens to it? And they showed in humans, in extensive studies, it cannot integrate into your DNA. This is not gene therapy. And two, it is so fragile that they had to cover it with a little bit of fat in order to give it to you, or a shell, okay? So gene therapy, altering DNA, that is something we do for congenital anomalies, birth defects, certain types of, that is a completely different topic that has nothing to do with vaccinology. I understand when you hear RNA and hear DNA, it sounds scary, but again, it's just a little book, not on how to make the virus, but how to make the hat. The book is fragile and the hat can't hurt you. And the book can't hurt you and the book can't get into your DNA. Again, the DNA is in the safe in the bedroom. Okay?
All right, one more.
Presentation, you'll note that AstraZeneca and Johnson & Johnson, in their shell, it's a DNA book they gave you. But that DNA book on how to make the hat, it cannot integrate. It cannot even get into the nucleus to get inside your DNA. It doesn't happen. That's what the 30 years of research was for. This did not happen overnight. It can't hurt you.
Did you say earlier, just to be clear, did you say earlier that your 4-year-old son will be vaccinated as soon as they fly the gate?
Oh yeah, as soon as they say it's safe to vaccinate 2 to 5-year-olds, my 4-year-old son is going to get it.
Wow.
Sure.
Okay. All right. Another question for you from our team, but this is something that has been asked as well by many persons on social media. Sickle cell. Is it safe for a person with sickle cell to get this vaccine? Any vaccine?
Yes. Yes. Let me just flip the way of thinking here. If you have an illness, whether it's something you're born with or something you acquired with age, like high blood pressure, diabetes, cancer, okay? Your immune system, that security force, is also your construction team. They're the ones that are trying to help fight illness. So when they are quote unquote distracted, overwhelmed, looking and trying to keep you healthy, and then you attack them and they don't have a special force, that is why the sick, the elderly, the people with comorbidities, whether it's sickle cell, hypertension, they're the ones that got the vaccine first because they need to have the special force at the door. Because the younger ones, they're not fighting other illnesses. They're not trying to keep it. Remember I told you, the army is looking for cancer, it's looking for anything that's not you, anything that looks sick, anything that looks mutated, and any intruder. So if you have sickle cell, I saw a sickle cell patient yesterday. Yesterday I saw one. Please, you guys should have been first in line. First in line. I saw a question in the comments. If you are prone to clotting, should you get the vaccine? Absolutely. Absolutely.
Saying that though, Dr. Arscott, if I may just interrupt you, you're saying that though in a certain context, when we have been told or web doctors have been telling us that some of these vaccines are creating clots in persons. So can you address that? I mean, you are saying that if you are prone to clots, get it. But we are being told that some of these vaccines have created clots. I mean, I've heard the answer to this, but could you share it with everyone?
Okay, so thanks for that question again. It was like towards the back end of the presentation. And so you'll go back and you'll see that in April, they say, hold on, AstraZeneca is causing some clotting issues, right? And they said, boy, they've seen some clots forming and these clots might kill you, etc. So much so that Angela Merkel got her first shot as AstraZeneca, then the Chancellor of Germany. This report came out, so she got a different shot for the second shot. And that is when we started talking about mixing and is it safe to mix? And yes, I can talk about the data where it shows that it's safe to mix certain vaccines, right? But why were they hesitant? Why am I saying if you're prone to clots, you should get it? Why are they saying, well, because they looked at the data and they said, I can go into how it causes clots. It causes something called platelet factor 4, but I won't get into the mechanism of action. What I will tell you is that the incidence, the chance of getting a clot from the vaccine is 1 in 250,000, meaning 4 in 1,000,000 people might get the clot. So you have 1,000,000 people, 4 might get the clot from the vaccine. If you caught the virus, you can get as much as 1 in 4 might get a clot. If you the ones who end up in the ICU, as high as 1 in 12 from the virus. Not 1 in 1,000,000, 1 in 12 might get a clot in the lung. 1 in 9 might get a clot in the leg from the virus. So if you're prone to clotting, if you just want to look at the raw numbers, which one are you going to take a chance with? Catching the virus, which is going rampantly around the country, or getting the vaccine? And if you do have any signs or are prone to clotting, we know how to prevent and treat now. Okay, so I have a friend of mine who is born with an issue. He's in California, where he's lacking a certain factor that prevents clotting, so he's prone to clotting. So he's on long-term blood thinners. He's my age. He's on anticoagulation, Xarelto. We have the patients on Xarelto. We have them on blood thinners to prevent the clot for those who are prone to clotting, or those who show up with a clot. But the numbers are not even in the same ballpark. If you catch COVID, the chance of you getting a clot is very high compared to if you took the vaccine.
Thank you. Now, there are some concerns also of not of the vaccines necessarily, but even some persons who have already gotten their vaccine. They have asked, are you concerned? You, Dr. Arscott, are you concerned, or what are your thoughts on the blanket immunity granted to vaccine manufacturers against severe side effects? You can answer that in any way.
Immunity against certain side effects.
The question really is saying, if I have any severe side effects after taking my vaccine, I can't sue AstraZeneca or the makers of AstraZeneca or the makers of any of these vaccines because they've been granted immunity. What are your thoughts?
Okay, so first of all, again, no royalties here. I'm not part of any of the vaccine groups, or I'm not even part of the government. Just speaking to you about just from a scientific standpoint. No medication, no treatment in 2021 is 100%. 100% effective or 100% safe. Okay? None. So if you said to me, the oral contraceptive pill, 1 in 1,000 will get a clot, no one's knocking on the door of FDA to take the pill off the market, and people taking the pill every day. Okay? Yes, we didn't even see the clotting side effects until it got up to 200, 300 million people getting the vaccine. That's how rare it was. Okay? They released, and that is why they followed it for 6 months, etc. Any medication, anything that's FDA approved or anything that comes to the market, is not a matter of if there will be side effects. There will be a side effect in, even if it's rare, in somebody. It's just a matter of the general population. Can we keep that extremely low? And the efficacy, the balance of the benefit of taking it is extremely high. So your options are, you know what? I'm not taking this because I have a 1 in a million chance of getting a clot. Or we take it and prevent the 19 people dying per day, just in Jamaica. Okay, so it's a risk-benefit ratio. I can't speak to the legal ramifications. Of course, everybody was on tenterhooks when they're making tough decisions early out, where they say, look, I know it's only 3 months, but we are seeing people dying. And this thing is 96% effective at preventing death. So let me fly the gate. And I'm saying, well, suppose at 4% want to come sue you. I'm saying, boy, what you want me to boss? I'm trying to save people. So if you want to find a reason not to do a particular surgical procedure, I always talk about informed consent. I can give you a complication. I might say it's 1 in a million chance. We're like, well, I'm not going to do that procedure. But I said, but this is what might save you. You have a 99.9% chance this will save you. I said, boy, but that 0.1% chance, I'll roll the dice and take the chance of that. That comes down to your personal decision at this point. Even when they come with the mandate, because they're going to come with the mandate, nothing in medicine is 100% effective. Nothing is 100% safe. That is why we continue to push on to try and improve.
Now I'm going to get to some of the questions that have been, or viewers who have joined us so impromptu because we just decided to do this morning to to open this up to the wider public. Dana from Instagram has asked, how normal are booster shots?
Good question. Very good question. So let's talk about boosters. All right. So you know,
I do.
right, that
Every Jamaican child knows.
every Jamaican child knows if you look on the immunization card, you'll see I got MMR when I was 1, when I was 5, and if you went to university, just before you went to university. Okay? You got certain vaccines at 6 months, 12, and they had a schedule, and then you haven't gotten it since. For those who work in the medical profession, we have to get the flu shot every year. What determines whether you need to get another shot or not? Remember, a couple things. One for certain, viruses change. Viruses change. And the chance of you needing a shot depends on whether this thing changes really quickly and how many people out there are vessels in which you've given it a chance to change. Okay? So measles, for instance, changes really quickly. But well up into the 95, 96, 97% of the population were vaccinated, so it doesn't have enough vessels in order to change in. So you don't have the new form of measles that you need to go get a shot for. When they started coming up with the anti-vaccine campaigns in New York a couple of decades ago, and in New York, the vaccine levels for MMR was falling, all of a sudden you started seeing measles outbreaks again because you had enough vessels in which it could change, and now we had to get a different hat. It was now a purple hat or a white hat, and now that is the booster. The booster is, okay, this thing has changed. I need to give your immune system a heads up on what the intruder looks like. He's not wearing a green hat anymore. He's wearing a purple hat. I say, okay, give me the purple hat because I need the SWAT team ready. So if you show up with the purple hat, I shoot him. That's what a booster is. So will we need a booster for COVID? You're now hearing rumblings. Why are you hearing rumblings? Because one, the hat has started to change. It hasn't changed enough that the majority of us don't recognize it. Efficacy for Pfizer went from 96% to 88%. Still very strong, but it's going down because the hat is changing a bit. And I told you, it's a better key multiplies more. If it changes enough, then we're going to have to, if it's not perfect, we're going to need a booster. What else happens? In some people, those memory cells, those memory B cells, the squaddies, that squadron that produce the handcuffs, squadron said, well, he hasn't been around, I don't see the intruder, And they get a little less and a little less and a little less. And they're measuring 6 months, a year later, in the average person, do you still have enough of this special SEAL Team 6 SWAT team in case he shows up again, especially the new form of the variant, the new guy. And they're saying in some vulnerable populations, the cancer, immunosuppressed people on immunotherapy, they're like, those guys, their immune system was so low to begin with, we need to give them a shot. So those people are getting a booster. The average person's not getting it yet because the hat is still green and we still have enough to protect ourselves. But if the hat changes enough, if we're going to allow this thing to continue to spread, then we will guarantee need a booster.
JDNs on Instagram asks, how soon after contracting COVID, I think you answered this briefly before, and recovering, can I get vaccinated?
Right. So as I said, thanks for that question again. So it was a moving target, as I said. Remember, initially it was that whole cytokine storm and all it was going to make you sick and you could potentially kill you if you got COVID and got the vaccine at the same time. We figured out why that's happening. We figured out how to treat that. Still happens in a rare instance, right? Especially if you're resource strapped. If you don't have those medications that can bind to IL-6 that shuts down the cytokine storm. Initially, they said 2 months. No, it's 2 weeks after your symptoms are gone. It's safe to go and get the shot. This was with up until the Delta variant raised its head, but there's no official FDA, CDC recommendation. This is based on the data that's coming out and what Vivek Murthy, who was a Surgeon General in the United States, said about a month and a half ago.
I would not want to be in your shoes, any medical professional shoes right now as you study Delta variant, to be very honest with you. One thing that has happened in Jamaica, though, and I'm surprised at it, but not so surprised. We received one shot. Some people received one shot, and then the take-up, I was told by one of the persons working in one of our vaccination centers, was that the second shot take-up was very low. Now, I want you to tell us how effective is the vaccine after one shot, and those people who are walking around with one shot and saying, I'm vaccinated, why they're incorrect.
Right, great question. So that depended on one, the vaccine, and which one you got, and the data that they had at the time when they did the study. Okay, remember I said studies were done at different times. So when Pfizer and Moderna did their studies, the main, almost the only enemy out there of note was the Alpha variant, the one that was in the UK when we hit our shores. Okay, by the time Johnson & Johnson was doing their study, they had the Beta and the Gamma variant. Okay, that was the one, the Brazilian and the South African variants, which were a bit more easily spread. Right? And all of those studies were based on people in the community who are vaccinated or not vaccinated, trying to fight those enemies. Now we have the Delta. Well, against those enemies, I think Pfizer, if you got one shot, it was 67%. And then you get up to 96%. Or again, I don't want to misquote, but one of the vaccines was 67, that went up to 96. One of them actually got as high as 85, and then it went up to mid-90s with their second shot. They show your protection. They show the lack of disease, not infection, but lack of disease and hospitalization based on you being fully immunized, meaning you got 2 shots. All the data that says it's going to prevent you from being hospitalized, it's going to prevent you from dying, is based on being fully vaccinated, which is defined as 2 weeks after your second shot. Why 2 weeks? Because you needed 2 weeks to build up the rest of the army. Remember, it takes 2 weeks to form the SWAT team? That is where the definition came from. There are a significant number of patients who only got 1 shot who still ended up in the hospital because the army wasn't big enough. And now that you have the Delta variant out there that really can break into the house because the key is better, that has 1,000 times more virus when they swab them, believe me, you need the big army. Which is why it's now affecting the younger folk and even the older folk with multiple comorbidities, all the other illnesses were vaccinated. So,
yeah, it really is very heartbreaking. So this is Dr. Ramon Arscott telling you, get your second shot, please, and thanks. There is a question from social media. I don't have the name of the person, and forgive me if I pronounce this incorrectly. My adult child has an autoimmune disease. He's taking ustekinumab. You nod like you know exactly what I'm saying. That's good. Would he be okay after taking the vaccine?
Great question. So this is for the general audience. If you see it is one of the, if you want to play hangman and find words that nobody else knows, use those words, right? Anything that ends in mab, M-A-B, anything that ends in mab is a handcuff that we've created in our lab. Okay, that's what it is. So whether it is whichever mab, right? They created a mab against IL-6. They created a mab.
That before, a mab.
A mab.
Yeah, that's it.
Whatever mab is a handcuff. Okay, it's what we call a monoclonal antibody. Okay.
Okay.
Whatever the autoimmune disorder this patient has, they've given him handcuffs to. Autoimmune means your immune system is attacking you. Autoimmune, it means, hold on, it went to school and don't realize that, listen, I'm not supposed to attack myself. I know what I am, so I'm only supposed to attack intruders and anything that doesn't look like me, a mutation of me. But people with autoimmune disorders are not attacking themselves. So they create this handcuff for the cell within the army, or the thing that it produces within the army, a cytokine, to stop it from attacking itself. What do you know about those patients? Those patients they are susceptible, because if you want to put them one way, their army is distracted. They need that SWAT team. So my lupus patients, rheumatoid arthritis, you name the autoimmune disorder, please go get the shot. I need you to have that SWAT team, okay? Because that falls into the category of a comorbidity, a disease that has your army distracted, okay? One of the other reasons why you create a certain amount of handcuffs and snipers when you just give it a hat, the army is not spending its time trying to kill the virus, it's just learning the hat. And so you have all the resources to create a big army. You're not wasting resources, cells, to try and fight an enemy. You're building an army in a calm setting when I give it a shot. Because I didn't give it a virus. I just gave you a book on how to make the hat. So if you have an autoimmune disorder, you're on any kind of chemotherapy, whether it be for cancer, or chemotherapy is to suppress the immune system, or it's for autoimmune disorder, whether it be specific chemotherapy or non-specific, whether it is a MAB or regular chemo, please go and get the shot. These are the patients that are first in line for the booster. Okay? Next one.
You made mention a while ago something that really hit home for me, and I'm sure for everyone else. You don't want your army distracted. You're against anything else if you have an autoimmune disease. So you need to get the vaccine in order to make sure everyone is focused on attacking what it needs to attack. And that really hit home for me. So thank you for that. Charmaine from Facebook asks, which vaccine is best suited for an ITP patient? And being a non-medical professional, I don't know what ITP means. I'm going to go out on a limb though and say it's similar to a MAB, maybe? No?
No.
Okay.
It's called idiopathic thrombocytopenia purpura.
You're going to say that one more time for me?
Okay.
It's what?
Idiopathic thrombocytopenic purpura. So these patients have, idiopathic means they don't know why they got it. That's what idiopathic means in medicine, okay? So just to break it down in English, this person who has ITP has a condition that's autoimmune where they are getting rid of their platelets, thrombocytopenia. Platelets are just some cells that we need to clot. Purpura just mean them bruise up all over the place. So as they bind and get rid of the platelets, they form little clots, but they don't have the platelets nor the clotting agents, so they end up bruising very easily. And it's idiopathic, they don't know why they get these auto. So ITP, idiopathic, yes. You form clots, not because of PF4 or the reason why the vaccine may do it or reason why the virus does it, right? You're forming clots because of the autoimmune disorder that mops up the little guys that help you to clot, okay? Which is why people with ITP bruise a lot. But without getting into a medical lecture, if you have ITP, please go and get your shot.
Yeah, all right. If you have ITP, go and get your shot. Would you care to comment on the use of ivermectin?
Okay, great. All right, so this came up in PSVI forum. Let's talk about ivermectin, okay?
And what it's used for, please.
Great. So when I was doing this forum, I did a 2-hour forum in another country with a different CMO who actually is from Africa. It's from the continent of Africa, and then went to the UK to do all this training. And I was privileged enough to be this guy as a partner on a panel, and we've done a few issues, a few functions together. I was privileged enough. Why? Because this is someone who he used ivermectin every day when he was treating rabies, scabies, when he's treating rosacea, when he's treating certain worm infections, parasitic infections in Africa, okay? And the doses, and he says, wow, this is something I use all the time. If this could work against COVID, wow, this would be fantastic. We were excited when we heard the data that, wow, ivermectin could be used to treat COVID. Then we looked at the paper. I believe it came out of Australia. And they looked at and said, where are they saying that ivermectin actually treats COVID and that it works? It was in a lab in a little petri dish. Fine. They put the coronavirus, the RNA virus in a dish. They put the ivermectin in there and say, whoa, it killed the virus. But that wasn't the important point. That's the important point. I got the tagline. The important point was how much ivermectin was needed to kill the virus. 4,000 times the dose you'd give to a human. If I told you to take 4,000 Tylenol or paracetamol right now, guess what happened? You're dead. The level of toxicity to a human was enough to kill a horse. That was required of ivermectin to kill it in a dish. But they got the tagline, wow, it killed the virus in a dish. So yeah, man, let it fly. So I said, all right. First of all, we're not giving patients that level of dose because you're going to kill the patient. It's going to cause liver failure. It's going to, even slightly higher doses exacerbate asthma. Okay. And then they said, okay. Everybody said, we need something to fight this virus. It's going haywire. We need all hands on deck. We need every tool in the armamentarium. So they throw up their hands and say, okay, let's do the study. Let's do safe doses that, remember we talked about phase 1, phase 2, phase 3, that will not send someone into liver failure. Any higher would send to liver failure, asthma, and so on, and see if it helps. Did not help one iota when they controlled for it. The doses, said, but they have these studies in humans where it helped. You looked on the study, they gave them ivermectin, steroids, remdesivir. They throw the kitchen sink at the patient and then said it was ivermectin. It's like I say, I give you a banana, melon, a cherry, patient get better and say, it's the melon. You have to either give them the melon or no melon, that's it. And that's what they did, and they realized no difference. Of course you know that because 1/4,000th of the dose is what was safe. So it's not a matter of, as I've heard some people say, well, just release it anyway and we just have a bunch of Jamaicans that don't have any worms. Deworm the population. No, that's not the danger. The danger is I had a 70-odd-year-old patient in my office who said, Doc, I said, I don't take the vaccine now. I'm taking the pill. I said, what pill, ma'am? There's no pill that's going to prevent COVID. They think that it is an alternative to the vaccine. That's the danger. So yes, deworm them. Yes, give them a safe dose, even though you know it's not helping. But don't give them confuse them enough that they think it's a crutch, that they don't have to go get the shot. That is my issue with ivermectin. So it doesn't work. The dose that works will kill you. And if you're promoting it, you're now muddying the waters even further for people who might think, well, I'm using this. And when I told her, she says, what, really? I said, yeah, she went and got this vaccine same time. She thought that she was being protected and she wasn't. So that's my 2 cents on ivermectin.
Thank you. That was a little more expensive than 2 cents. I mean, I'm just saying. I just want to say, we do have some people who have just joined us. We have some team members who have left our chat here or on our Zoom chat and are now on social media heading home. And I want to reiterate, on August 27 and August 30, we are having our own vaccination blitz here at Sagicor Group Jamaica at our auditorium. However, it is for our team members and up to 4, no more than 4 of their friends. The way you get your shot here at Sagicor is if you know a friend at Sagicor and that friend registers you by name. So Sagicor team, Sagicor Massive, if you know anyone who wants to be vaccinated using using our facilities here, they haven't had a chance to do it elsewhere. If you know anyone who needs to be vaccinated and they reach out to you, this is one time if somebody slide into your DMs, beg you to please answer so that you can register them to get their vaccination right here at Sagicor. It is free of cost to our team members, their dependents, their friends, and their family. Please take advantage of this opportunity. It's actually, I mean, we're Sagicor, we're a little bit extra, so it's going to be very exciting for anyone who comes on down to get vaccinated. This is August 27, and this is August 30. I'm just checking my notes here. To see if, okay, all right. So we're going to take one more question from Shauna from Instagram, who says, if you are vaccinated or not, you can get infected and infect others, and you can still die from COVID. I don't know about the can still die part, based on how much, based on how you have educated me, Dr. Arscott. So when they say get vaccinated to protect others, why are people still getting and passing the virus?
Great question. So, by the way, if you want another summary of this talk with more graphics, a bit to kind of try and drive home some of the questions, some of the points that were discussed today. Yes, this is going to be posted, but you can also just go on YouTube and type in "The War on COVID" and my name with Ramon Arscott, and it's not quite as long as this. But it's a documentary, 50 minutes long, that the BBC went and added some more data to. So to your question on infection versus disease, when I did that talk, it was released on June 4th, Delta hadn't really raised its head very much. All the data shows, remember I said, you have the army, alpha, beta, gamma, anybody breaks in, you can catch it, you'll test positive for COVID. But the army is there to cuff him and shoot him. So you didn't have enough to give away, and you didn't have enough to kill him. The reason Delta is worse, the reason why they've made all the changes and got rid of mask mandates and people allowed to eat inside if they're vaccinated and so on, was because up until then, up until Delta came out, if you had your vaccine, you could catch COVID, but you had the army to cuff him and shoot him so that you didn't have enough for him to multiply and didn't have enough to give away. So that's why are they starting to roll back that a little bit? Because in 1% of vaccinated people, 1% of vaccinated people who catch Delta, it manages to escape the squadron with the handcuffs. The data is showing 1%, the guys that have the handcuffs, the ones that go and catch it before it breaks into a cell, they haven't gotten the data on the SWAT team yet, but 1%, they slip out the handcuffs. The antibodies don't bind to the cell. So it gets a chance to break in and multiply, and which is why they're saying, if you look on there, patients who actually break through in that 1%, who are vaccinated and catch it, who happen to be who? The under 50 who are not vaccinated, those definitely, but the over 50 vaccinated who have other illnesses. Those are the ones who make up the majority of that 1%. 99% still have an army that will cuff him and shoot him. But because 1 in 100 now have that ability to say, whoa, it slipped the army with the Delta, not the Alpha, the Gamma, the Beta, with the Delta, they said, you know what? You guys need to put on your mask because it won't kill you, that 1%. Because what they found that they might get enough to pass on, but it's not killing them. So it is still preventing death and hospitalization. That is a myth. That you're getting vaccinated and no, it's still going to kill you. So why? It won't stop infection. The guy will break in, but it'll stop death and hospitalization and death. But 1% of the 50-year-olds or over 50 who have illnesses can get enough to pass on, which is why they're now saying with the Delta, you have to put back on the mask. We have to continue social distancing because whether you have the vaccine or not, if you have on the mask, it can't come in. It has to be able to get in to cause damage, which is why when I say wear a mask, I'm not saying on your forehead, I'm not saying on your chin, not over your mouth with your nose exposed, cover all entries that this thing can't get in. But we'll be stuck in that mode of living until we get enough people vaccinated and they don't have a safe haven, enough people for it to multiply in so it can continue to perpetuate. That is where the 75, 80% comes in, 70%. We have to decrease the amount of people in which this thing can multiply in. We have to wait until then.
We have to decrease it so that we can stop living under curfew, right? And unfortunately, we won't be able to talk all night because some of us have to get home I'm not a medical professional, so we have to get home to our families before curfew. But what would you say to someone who is allergic to antibiotics and is nervous or skeptical about COVID vaccines?
So great question. Anybody who's gotten the vaccine would note that one of the few things that they do right after you get the shot is have you sit down and they watch you for 15 minutes, at least 15 minutes. Why? Because if you're going to get an allergic reaction, it'll happen that quickly and they can treat you. Okay? Anybody with major side effects, it happened, other than allergic reaction, it would happen in 6 weeks. We're almost a year into this and we haven't seen anything major. Okay, apart from the clotting, we spoke about that and everything. But allergic reactions, they can happen, but that is why but it's rare as hen's teeth, right? So they watch you for 15 minutes so that they can treat you if you do have allergic reaction. Do not get the vaccine. Please, I'm begging you, for the country, for your family, I know we're supposed to say, look, I want you to hope this makes you feel more comfortable getting it. I'm going to tell you that I personally I strongly encourage it. I know it's a personal choice, but I always leave the example. Yes, it's your choice whether you want to risk getting it or not, but how is it somebody else's choice to put me in danger? And you catching it, or Joe catching it, puts Mark in danger because he's possibly created another monster. Another example, they don't lock you up for speeding because you're about to kill yourself. They lock you up for speeding because you're a danger to others. So there are things we do in society to protect society. This is one of them. I'll leave it there.
Thank you so much. That's an excellent, leave it there, the end. In another forum, we'd say drop the mic, right? Okay, so Advantage General is also included. Advantage General, a member of the Sagicor Group, team members are also included in our Vax Days, which are August 27 and August 30. Once again, if you are a friend of somebody who works at Sagicor Group Jamaica or Advantage General, reach out to them and let them know that you would like to be registered for this vaccine, and they will need to register you. Do not show up at Sagicor. The information will be passed on to our team members and they will in turn pass it on to you. Thank you. Please join me, everyone, in extending heartfelt thanks to immunology strategist Dr. Ramon Arscott. Thank you, Dr. Arscott, on behalf of a grateful nation, on behalf of Taylor Hall, on behalf of the Assembly Hall, everyone who you went to school with, your mom, my doctor. Thank you very much. Please feel free to revisit this video on our Facebook page, Sagicor Group Jamaica. And I also want to say thank you to our human resource team who has been working so hard, tirelessly. And I hope that they set the example, or I know they've set the example. I hope others are following the example across Jamaica to just rally your entire team around allowing us to get vaxxed and get back to life. Once again, thank you all so much. Thank you, Sagicor team and Advantage General team and PanJam team and St. Vincent and the Grenadines. And I know I missed many persons. Thank you also, everyone who joined us. I hear we were actually live on YouTube. Thank you for those of you who joined. Thank you to those of you who joined us. Thank you also to those who joined on Facebook and Instagram. Thank you so much. We appreciate your joining us. So it's Advantage General, PanJam, Berger Paint, CWJ Cooperative Credit Union, the National Housing Trust, members of GIFs, and St. Vincent and the Grenadines East Caribbean ECGC Company. Thank you so much. Thank you, Dr. Arscott. We appreciate you. And if you would like, you can rewatch this live broadcast on Facebook. We're going to try and save it on Instagram as well. We'll also be sharing it on our YouTube channel. And Mr. Christopher Zaka, Chairman, our boss, thank you so much for this stroke of genius in inviting Dr. Ramon Arscott. We appreciate it. Ramon and your family, be safe, keep safe, everyone. I'm Alicia Moulton White, and it's been my pleasure. Have a great evening.